Developing a fitness plan is very important. There are several principles that should be followed. One of them is that if someone has not exercised in many, many years, probably should speak with their healthcare provider about whether it's the right time to start exercising and whether something should be done before a person starts exercising. For example, if someone has been having chest pains recently, that is not the right time to exercise. It's probably better to make sure that that person does not have significant cardiac problems that need to be taken care of first. So that is just one example. As I mentioned, it is important, particularly in people that have not exercised in a long time, to speak with their healthcare provider first. The second issue has to do with start very slowly and increase progressively as your body tolerates the exercise. If this can be done under supervision by a trainer or an exercise physiologist, is even better. But if there is no access to this, it is important to start very slowly as tolerated by your body, and then increase progressively. Another important principle is to remember that before starting exercise, before go on and jogging or going on the bike, to stretch your muscles very well for 5 to 10 minutes and do a warm-up before doing strenuous exercise. Otherwise, there is a high risk of developing muscle strains or joint sprains. Now, how much exercise to do? Typically, to obtain the benefits of exercise, one needs to exercise between what is called between 50 to 70% of the maximum effort. So how can one determine what the maximum effort is? And that's basically a formula. One deducts the age from 220. So one deducts 220 minus 60, which is 160. That is what is called the maximum heart rate, 100% of heart rate. Now, a person will not exercise. We don't want a person to exercise that much because that's 100%. So we would want to start perhaps at 50% of the maximum heart rate. So in that case, for that person who's 60 years old, then 50% of their maximum heart rate would be 80 beats per minute. So that person can exercise, and as they're exercising, they can count their beats per minute and target the amount of exercise necessary to have their heart beat 80 times per minute. So that would be, for example, a good way to start. If that person cannot, if 50% is too much, they can do perhaps 40%, which will decrease the amount of heartbeats per minute. After a few weeks or after a few months, if that person can tolerate it, that person can increase it maybe 10% more. So instead of exercising at 50% of their maximum heart rate, they can increase to 60%. And after doing that for a few weeks or a few months, they can even increase it to 70 or 80%. So maintaining 70 or 80% of the maximal effort would be ideal. It is very important, as I mentioned before, to do this as tolerated and preferably under the supervision of an expert.